Hi, everyone. It's Dr. Latowski. Can everyone hear me okay? Let's see. Is there a way to see? There we go. Oh, there we go. Hi, everyone. Yes, thank you so much for attending today. So today I'm going to talk to you about two very exciting technologies that I've been combining, and the results have just been amazing. And just wait till you hear what these two things can do together. And then I will also show you how I do this in real life. So I have a model, and we are going to do both of these modalities today. So thank you again for attending. I'm so excited to talk to you about these top tools that are going to tighten and lift and glow, make yourself glow. So here are some of the options we have available. Today we're talking about the two in pink. So we're combining in a strategic way our biostimulators and Agnes, which is radio frequency with microneedling. So why are you watching this webinar? After speaking with patients who have given me feedback about webinars, thank you all so much. You might be thinking, I'm watching this because I look tired. I'm watching this because I don't like looking in the mirror, or because I look older than I feel. Or maybe you don't want a facelift and you want to do something that either prolongs the time between now and a facelift, or you just want to avoid a facelift altogether. Maybe facelift isn't in your budget. Maybe you don't want to undergo general anesthesia, but you don't want surgery for whatever reason. And most importantly, because you want to look your best. And I know that I have personally felt all of these things, especially the first one. When I look in the mirror and I see I'm looking tired, it always makes me want to go and do one of these safe and minimally invasive technologies. So we're going to build off our last webinar, which was filling of the jawline. So filling the jawline can strategically add structure. So we pull back and reduce the jowl area. Today, I'm going to show you another way that I reduce the jowl area. And it's much different, and I'm excited to show you. So you've heard me talk about these two modalities separately. Both have been around for a long while, long enough for us to know the ins and outs of these technologies and what they can and can't do. So Agnes, I kind of summarize it by saying that we use Agnes to lift and tighten the skin. So Agnes can lift your eyelids. It can tighten around your eyelids. It can lift the lower face, pull back towards your ear, kind of in that facelift vector. It can tighten this loose skin here. It can lift the neck. It can tighten the neck, again, in that facelift vector. Sculptra we use to replace age-related volume loss. So we get skinny in the face as time goes on, or we start getting heavy down here, but skinny up here. And I can use Sculptra strategically to replace some of that age-related volume loss and also build back structure. So just like when I was strategically putting structure back here, Sculptra can strategically put structure in that area and in other areas. Both of these treatments stimulate your own collagen much more so than filler. And that results in, number one, longer lasting treatments. So these tend to be more of a value for patients because the results are very long lasting. Also, they give you this kind of glow. And when the Sculptra company starts promoting Sculptra in a few months, they are really going to focus what they're going to call Sculptra Glow. And I think that is such a great idea because you really do see this youthful glow. I've experienced it myself. Usually a few months after doing Sculptra, I'll start to just look better, and patients and staff will compliment me on the quality of my skin. And so you just have this really healthy glow in contrast to dulling of the skin, which can happen over time normally. So you know that aging starts very early. So in the 30s, we still look great, but our collagen production is slowing down. We're accumulating sun damage. We're starting to collect a few wrinkles, especially in areas that have been exposed to the sun. And we're starting already to lose some volume in the face. The 40s, all that is accelerated. And we start to notice these characteristic wrinkles in the frown lines, the crow's feet, around the nose. We start to notice a little bit of heaviness down here, more volume loss. And then 50s and 60s, again, everything's accelerated and we're really starting to see the jowls and more loose skin down here. And that's exactly what we're focusing on today. And also we're losing structure in the cheeks, around the eyes, and jawline due to bone loss. And that's where we get strategic with the structural replacement. And we can build that back up safely in a very natural and age-appropriate looking way. So here's a graph again. Starting at 18 years old, we start losing our collagen. But you can see at 30 years old, we've lost 10% of our collagen and so on. So even by 50 years old, we've got 30% of our collagen gone. So it's really useful to do these things that build collagen over time, because that's going to help you look more youthful. It's going to help also slow down this aging process. So if you go backwards on the graph, you're slowing everything down. So again, you can kind of thinking of these things both similar, but yet doing different things. So Agnes does more for this laxity, and I can really precisely target what we want to treat. And I often use it on the neck and lower face and around the eyelids. It improves the skin texture and smoothness because it's stimulating collagen. We talked about how both stimulate collagen and improve fine lines and wrinkles. Sculpture can help with the crepey skin, and it can lift and restore volume and structure, again, strategically in a very natural and looking way. So let me talk to you about Agnes. Agnes is the name of this device. So it's a machine, and kind of looks like, you might say that looks like a laser, but rather than a laser, it's actually microneedling. But instead of it being a traditional microneedling with a handpiece with multiple needles, it's either one needle or three needles on this device. So there's actually a selection of 9 different needles that I can choose based on your skin type and where we're treating. So I choose that based on what's going to give you the best and safest results. Then what I do is put the needle on the device and I put in the settings for the radio frequency. Radio frequency is energy that heats the skin. And so the heat causes the new collagen to generate, and then the collagen causes the skin to tighten. And again, that gives you a youthful look, and it also slows down the aging process. Agnes uses something called monopolar radio frequency, which allows for very precise tightening, versus bipolar, which is found in some other radio frequency devices, which is a great technology, but it's just a little bit less precise. So this device works really well when we're specifically targeting fine lines and those wrinkles around the eyes. The preciseness allows for me to strategically shape the skin and underlying tissue as well. So in other words, I can deliver concentrated energy to targeted areas that will help create a more youthful appearance. Also, these little tiny needles are micro-insulated. So what that means is I can protect the top layer of skin. So if you see the little cartoon on the right, the needles are insulated on the top part. So you can see the top part of the skin, called the epidermis, is completely protected. The bottom part of the needle is not insulated, and that's where the little fire cartoon is around. That's the heat coming out of the needle, and that's very selective. And that's what is going to really heat the skin. here's a little pictorial view on what this device looks like. And so this device can treat fat, this device can tighten skin, and this device can actually tighten or reduce oil glands, make the skin less oily, and also treat acne. So there's multiple different things this device can do. Again, it's all very precise and dependent upon the needle that we use and the settings that we use. And we talk about all that during your cosmetic consultation. Here's an example of areas we can use the Agnes. We can also use it for body contouring. So stubborn fat pockets. I myself had this procedure done around the fat pockets adjacent to my knee, and I've been extremely pleased with the results. It was really, really effective at reshaping my leg to make the leg look less bulky and more feminine. So I really like Agnes because it can come pretty close to a surgical result. No, it does not replace a facelift, but in certain patients, we can get pretty dramatic results. And compared to a surgery, there's much less downtime, there's much less risk, and there's much less time in office. Agnes, in contrast to some of the lasers that we do in the office, can be used year round. And while initial improvement is seen after 2 weeks, you will continue to see improvement over 6 months. So I love this because you get like some instant gratification. You see immediate improvement. But over the next 6 months, you're getting better and better. And I love that. I always like to feel like I'm improving. So instead of aging, you're actually going backwards. We threw together this little graph just to show you how this technology differs from Morpheus and traditional microneedling. And I've gone through most of these concepts already, but microneedling, you don't have the heat. So although I love microneedling, it's a great treatment, and we do that treatment here, this is a little bit more of a powerful treatment. Morpheus 8, because this is monopolar, it's a little bit more precise, and in my opinion, a little bit more powerful than Morpheus 8. And I also find it to be much more effective around the eyes for the bags of the eyes and for fine lines. So this is very easy. I like to avoid sun exposure for 2 weeks prior. This doesn't mean stay out of the sun, but maybe don't do this treatment when you've just gotten home from Mexico or Hawaii, etc. And then the other restrictions are pretty easy. We use numbing cream, and then I actually inject numbing underneath the skin. And my model has actually had that done today. I did that for her before the webinar. So patients always feel a little puffy in this area or whatever area we're treating. And okay, sorry guys, a little technical difficulties. Can you guys see me now? All right, great. Thank you, Diane. Okay, so post-treatment, the downtime can be very minimal. So I usually tell patients 3 to 14 days. That's kind of a wide window, but some patients come back in and they're like, that was the easiest thing I've ever done. I couldn't tell I had it done. There was no pain, no downtime. Other patients say that they were pretty puffy for 2 weeks, or they were a little bit sore for 2 weeks. And I had one patient once who took some ibuprofen for a few days afterwards. So it does vary individually. But for most patients, this is not a big deal to heal from. Chance of bruising, a little swollen afterwards. By 2 weeks, we're seeing results, and you continue to improve for 6 months. Usually, we do this treatment not super commonly. I usually tell patients between 1 and 3 treatments. Most patients, 90% of my patients do 1 treatment. And then because this is a permanent in aesthetics, meaning this changes your skin, it's a permanent tightening, but nothing's truly permanent in aesthetics because we continue to age at the same time. So we're permanently tightening, but you're aging. So I usually say once every 18 months or so would probably be the repeat time. But again, that varies individually, and we can talk about that during your consultation. Afterwards, it's really easy. No makeup or exercise for 48 hours, but after that, you can get back to the gym. You can go back to makeup, and it's very, very easy. Okay, so here are some pictures. This patient actually had 2 treatments, and you can see over the course of time, her face is becoming more feminine and tighter looking. So this is a treatment that really improves the overall look of the face and makes us look more youthful and like we used to 10 or 20 years ago. So you can see on the left, she looks her skin is starting to look a little square. Her jowls are heavier. In the middle, that's 3 weeks after the second treatment, the jowls are less. Her facial shape has turned to more oval. And then on the right, her proportions are more appropriate. I'm looking at her cheeks first instead of looking at her lower face. The area around her eyes looks tighter, even though I did nothing to treat that area. I just treated her lower face and jowl area. And I'm going to show you a side view of her too. So again, not perfect results, but we weren't going for perfection here. This is after 2 treatments. You can see the beginning on the left, 3 weeks after the second treatment, jowls getting smaller, neck looks tighter. I'm starting to see more definition in her cheek. And then on the right, I did nothing to treat her cheek, but now I'm seeing beautiful contour in her cheek. Her eyes look younger and more refreshed. I did nothing in that area. And her jawline looks tighter, and her jowls have less volume there. Sometimes that's hard for patients to see. They're not used to looking at these photos. Remember, we see each other in 3D, but these photos are 2D, so try to keep that in mind. But really think about the volume of her jowls and look how much less they are after 2 treatments, and she is still improving because the follow-up photo was just 4 months after her second treatment. Same patient, other side. So we see, again, the jowls are getting smaller and her skin is getting tighter, and therefore we focus on the beauty of the other parts of her face, and we focus less on the lower face and the jowls. Here's a patient, we did 1 treatment of the neck. You can see this pictorial. Before on the left, look at the texture, look at the hanging skin, look at the wrinkles, and then you can see her skin gradually tightening over time. And for those of you looking at the bands of her neck, I could treat those with Botox. She elected not to do that. But you can see the quality, texture, and tightness of her skin is much tighter. Same patient, different angle. You can see how she improved after 1 treatment over time. So if you watch my webinars, you might recognize this patient. I did her treatment during a webinar. We did 1 treatment about 4 months ago. So we just took these follow-up photos. And for this patient, we were going more for facial slimming and shaping. So you can see that even though you don't look at this patient and think she's had something done or a surgery done, but she looks a lot more feminine and youthful on the right. And you might not be able to put your finger on it, but her facial shape looks more feminine and youthful. And here's a side view. And look how much more contoured her cheeks look, even though I just treated around her jawline and a little bit under her chin to help sharpen the jawline and melt the fat in that area. So it can completely reshape the face, but in a natural and beautiful and feminine way. Feminine in females. I also do this on males. So here's an example for around the eyes. This patient did not have any bags, so this treatment can treat bags. It can also treat lines. She had one treatment. This is simply 3 weeks after one treatment. She looks even better now, but you can see the difference in the texture and the fine lines. And again, one treatment, upper eyelid only, and you can see her eye really opened up. This patient was thrilled. Her daughter noticed the difference. She noticed the difference. She's absolutely thrilled. By now she will have had more results than this. Just completely opened her eyes, and she felt a difference too in the heaviness of her eyes. Here's one treatment. She was starting to get very square on her bottom face, although what we're really treating is the texture of her skin. But we notice how her skin looks less square 6 weeks after one treatment. And now this is 6 months after one treatment. You can see her face looks tighter in the lower face. And here's a side view. What I was really going for was that texture change. So we really wanted to improve that genetic sun damage texture that you can see on the left. And we can see on the right, it looks really, really improved, much smoother. If we continued, this is a patient who might want to undergo 3 treatments. If we continue doing this, we'd really focus on that texture and really smooth out that area. So this patient, this was only 2 months after one treatment. You can see her jowls are smaller, but she's got a lot of improvement in the fine lines. So look at her lower face in this area, and you can see she had so much improvement here. This is one patient that told me is the easiest healing out of anything that she's ever done. And she got tighter skin, smaller jowls, and the skin is so much smoother in those areas. And then finally, this patient, we treated her lower face. We saw her 3 months after one treatment. She looks so much tighter, and her face just looks a lot more feminine and more youthful. Here's a side view. You can see how much tighter she looks on her lower face. Oh, this is also one of our patients from a webinar, but I did this treatment before the webinar. So on the right is the photo actually that was pre-webinar, but on the left is before we got started. So I did filler in here. I did Kybella for her area under her chin, and then I did Agnes for her jowl area and lower face. And you can see how her face is reshaped, looks brighter. Of course, I did a combination of things, but we're talking about combinations today, so I wanted to show this to you. By the way, on the right, she has no facial makeup on. On the left, she also does not. On the right, she has done her eyes, but she has no foundation on her skin. That is how her skin glowed after doing the Agnes and the filler to kind of contour the skin and to reduce the size of the jowls. Look at the difference in the size of her jowls in these 2 photos. So this was only 2 months after one treatment. And if you look at the very beginning and the very end, it's even more dramatic than that. But I wanted to show you what the Agnes specifically can do. So look at the size of her jowls in this area, in this view, and look at how her cheek just looks so much more contoured. Again, I did filler in her cheek, but you can really see her natural beauty come out here. Okay, we are combining the Agnes with Sculptra. So Sculptra is an FDA-approved biostimulator. What does that mean? It's not a filler. So a filler tends to be a gel that goes into the skin. The Sculptra is something that's injected and stimulates your own collagen to grow. So it restores and replaces lost volume due to aging. So we can lift the face, we can volumize the face strategically, and we can improve skin texture. And like I mentioned before, give you a glow in the treated area. So I love Sculptra. It's one of my favorite products. And you'll hear that if an injector has worked with Sculptra before, they tend to say it's one of their favorite injectable products. So I've done so much Sculptra that I have also been asked to work with the company for their research and its recent FDA modification of their label. So I've been their principal investigator at Investigate ND for multiple year Sculptra trials, and this resulted in multiple publications. And the company even asked me to present some of this data in Paris and in their Train the Trainer event in California. So I've been very, very honored to work extensively with this product, and I absolutely love it. So how does it work? So once it's injected, stimulates your collagen, and that smooths, tightens, lifts, and provides support for the skin. It can take several months to see the results, but the results maximize at 6 months and last at least 2.5 years, probably longer. But of course, we're aging at the same time. So here are the areas we can use Sculptra. You can also use Sculptra on the body. Very easy pre-treatment. You can do this any time of year. We use numbing cream, ice, strategic injections. It's really quite comfortable. Bruising can be expected, but it's actually not that common. And we have several techniques in the office to make it much more comfortable for you. Here are some examples of before and after. I have a very conservative approach, extremely conservative. So many of these pictures I'm showing you will be 1 vial of Sculptra, and a lot of times I recommend 1 or 2 or even 3 vials to start with, and then just maintaining with 1 vial a year. So we threw in also some the company's photos where more vials were used, just to let you know what we can accomplish with more vials. So 1 vial of Sculptra here, you can see a beautiful lift in her cheeks, less heaviness in the lower face. Now, if I had done Agnes in her lower face as well, I think her results would be out of this world. So again, this is why we're combining these treatments. So we got a beautiful lift, only 1 vial of Sculptra in this patient. I would love to use a little Agnes on her to reduce the heaviness in the lower face. Here's a company photo. This is 3 vials of Sculptra. What can be achieved with 3 vials of Sculptra. Here's another patient who had a couple vials of Sculptra. She was a little bit older than some of these other photos that you see, and she got amazing results in skin texture and lift. Here's a company photo, and this is 4 vials of Sculptra. This is one of my patients, 1 vial of Sculptra. Company photo, 6 vials of Sculptra, but look how amazing she looks. Look how much younger she looks. And again, look at that beautiful texture, tone, and improvement in the fine lines and crepiness. This is my photo. So this combination of both these collagen promoting treatments is ideal for promoting a very youthful and natural looking appearance. And this combination can be done at the same time with little to no downtime. These are 2 safe treatments. The results will last 4 years. I'm really passionate about these two treatments, and I think they're just such a great combination. Discomfort and pain, I touched on this a little bit. We have strategic ways to minimize discomfort in the office. We use ice. I strategically numb with lidocaine. I have several assistants working in the room to make things easier. I even have on-demand nitrous oxide, the Pronox brand, which you can use, and it wears off immediately. You can drive home same day, so that takes the edge off with any tight feelings or nervousness. My patients tell me almost universally this is not as bad as they thought it was going to be. So I am going to tell you if you're a candidate, but most patients are a candidate. Like you saw in the slides earlier, even at 30 years old, someone can benefit from Sculptra from a little bit of Agnes treatment. And these treatments are really customizable. So I will help to guide you and we'll come up with a treatment plan together. So we have lots of strategies to reduce bruising. And also we have different types of technology. I have a laser and I have an IPL device that can reduce the duration of bruising should you happen to get a bruise. Here is your prize for attending the raffle today or attending this webinar today. You'll be automatically entered into this raffle with your Protect Your Investment package. You get an Elta MD sunscreen stick, which is very convenient and great to use with the upcoming warm weather. And also SkinCeuticals Phytocorrective Gel. I love this gel. It has antioxidants in it. And it's very soothing anytime you get a little extra sun, have a procedure, etc. All right, so I'm going to talk about some of the webinar or the promos today. It's your Tighten Lift and Glow experience. And due to scheduling availability, we're only offering these to webinar participants and 5 only of each offer. And only today we will honor these promos. So I want you to have these results as soon as possible. I was just talking to one of my patients and I was telling her I'm the type of person, if I decide to do something, I want it done yesterday. And I think a lot of us are like that, especially when we're thinking about upcoming summer plans and events that we have going on. And so for those of you attending this webinar, if you're interested, we have special access for you. So I'm going to open up my Tuesday admin and research days for anytime 8 to 4 in the next 30 days so you can start enjoying your results almost immediately. And then, as you know, you have access to a special cosmetic phone number and email. So you can text Kayla, call Kayla, email her. If you have any questions after this webinar, she's happy to help. And she will also help get you in ASAP so you can start enjoying these results before the summer. And so we want you to get this done. I know your time is precious. I want to do this all for you in one session within the next 30 days. So this kind of thing appeals to myself. So I hope it also appeals to you. So here is our experience for you. So we are offering cosmetic consultation, 1 vial of Sculptra, an Agnes treatment of 1 area, the exclusive access to the private time slots, and of course, the private phone number and email. You always have access to that anyway. We're going to send you a no bruise packet, which includes your do's, don'ts, medical grade bromelain and arnica that I recommend. We're going to include our painless injection pack for you. And I would like you to have the option, because I'm not offering this to your friends. This is one thing I wanted to offer. If you want, you can bring a friend to this VIP time slot or a spouse. And if you want to bring your spouse and say, hey, what do you think he or she needs? I'm happy to do that for you during that VIP time slot. And also your friend or spouse will receive a discount should they elect to treat that day. So this is all designed to maximize your time and get you in soon so you can start enjoying these results. So this package is $3,000. And if you book within an hour, you receive a bonus of a targeted anti-brown spot treatment. So show me the brown spots you don't like, and I will use various modalities, whatever I think will get rid of them the safest and easiest way, whether that's IPL, cosmetic use of liquid nitrogen, chemical peel, etc. Level 2, so this is $3,800 and includes cosmetic consultation, 2 vials of Sculptra, Agnes treatment of 1 area to pull back and tighten, the exclusive access to your private time slot. As always, you have access to this private phone number and email to schedule, the no bruise packet mailed to you, your painless injection pack, and the friend spouse option for you to bring to your VIP time slot. As well, you have the option for the bonus if you book within the first hour. Let's see. Should I do that?
You can do it. It won't do it.
Okay.
You might want to try hitting this and refreshing.
Okay.
It's still internet.
It's spinning, so let me see. Okay, I'm back. Can you guys hear me again? Awesome. Thank you, Diane, again. That promo was so good, it broke the internet. So, okay, finally, level 3. So this is more of an investment, but it's going to cover a lot more ground. We're going to treat 2 areas of Agnes and do 2 vials of Sculptra. So this is like your little mini facelift without doing an actual facelift. So this is just such a great option, you guys. And I know it's an investment, but if you are thinking you really want to see change in your lower face and your neck, or you can't decide between your eyes and your lower face, or you want to treat your knees, bra fat, etc., this might be something you think about. And it also includes 2 vials of Sculptra. This is actually a really great combo, and we can get this all done in one session. Kaylee asked, how do we know how many vials of Sculptra we will need without a consult? Well, I will tell you, the company's view on this is that if you're 30 years old, you need 3 vials. If you're 40 years old, you need 4 vials. If you're 50 years old, you need 5 vials, etc. So more Sculptra is generally better. And if you commit to 2 vials, but you only need 1, we can substitute that for filler for a more immediate effect if you'd like. But most patients, even my young patients attending this webinar, could benefit from 2 vials of Sculptra. So I will say that. So I purposely did not make this with multiple vials of Sculptra. That way we don't end up having more than we need. So I would say probably everyone attending this webinar could use at least 2 vials of Sculptra. I personally have done 6 or 7 vials of Sculptra, not all at once, but over the last, say 10 years. So it's a really great product and looks super natural, and is really great for, like I said, virtually everyone. So with that, thank you again for attending and for sticking with us through these technical difficulties. And remember, why would you book one of these promos? Maybe because you feel like you look tired, because you don't like looking in the mirror. And I hate hearing that. When you look in the mirror, you should feel so happy and confident and just proud of yourself for all of your accomplishments that you've achieved. I want you to look as old as you feel. I don't want you to feel like you look older than you feel. I want you to feel like you don't need a facelift if you don't want to undergo that procedure. And I want you to feel like you look your best. So think about taking advantage of one of these promos. And now on to our live demo. Thank you everyone for your attention. We're going to pause the screen just for a moment, and then we'll get started with both Sculptra and Agnes to our model. All right, guys, welcome back. This is Jenna. Some of you may recognize her. She is a practice manager and director of research. So she wears a lot of hats. And you may also recognize her because we have done Sculptra before on camera. And so we'll be starting with some Sculptra for her upper face, which is something she's had done before. And so this is kind of more of a maintenance treatment. So we're just going to put a little Sculptra in her temples. And what that will do, that will pull up on her eyelids. So that will make her eyes look wider and more alert, and of course, in a natural way. And then I'm also going to lift her cheek. In the cheek, I use a technique that will also theoretically slow down bone resorption. So this is going to preserve her cheekbone, and in doing so, provide structure for her face and slow the rate with which everything comes down. So we're going to enhance her cheekbone, and then I'm just going to support her middle cheek by supporting this area right here. That's going to lift her entire face. And then on her lower face, we'll do Agnes to really soften this area in here and tighten. So even though she's young, she's beautiful, we are doing this to slow down the aging process and make her look even younger. So here we go. So we have pre-numbed her, and we did so about an hour ago. So some patients are fast metabolizers of numbing, and so she might be one of these patients. So we'll see. And we'll see. I know we're kind of limited by time too. So, but I for sure want to show you how we can use these two products to lift the skin in a pretty easy way for the patient. So sorry, Jenna. Okay, so pressure here. Sorry, my dear. There we go. And I've had this discussion with some webinar participants before, and this is one of these things that almost looks harder than it is as a patient. So how is it feeling, Jenna?
Fine.
Okay. Is the numbing still there, you think, or
Mm-hmm.
you think it's worn off a little bit?
Feels like it's still there.
Okay, good. All right. So we are doing this to really lift this area. I told her before it's not going to take much. So we're going to do 1 vial of Sculptra for her total. So half her area. All right, my dear. Turn this way. Excellent. Great job. Beautiful. Okay, now turn away from me. Great. So now I will use this method of going along the cheekbone to provide support for her bony structure, but also to lift the cheek. Great, Jenna. No pressure here, my dear. Doing okay?
Uh-huh.
Awesome. You did so well with that. And then last area of Sculptra, I'm going to have you turn this way and neutral for me. Beautiful. Okay. Last area of Sculptra will be towards the mid face here. All right, here. So a little pressure. So I have numbed these areas up with lidocaine before. Good job. So hopefully she's fairly comfortable. Usually we don't let the numbing sit for an hour.
here. She's got a little, we talked about this earlier, she has a little bit of scarring in this area. So my empty is a different entry point. Sit for a second. Sure. So Sculptra is also really amazing for acne scarring. I use this frequently. In fact, I use it a lot in teenagers because teenagers can build collagen so rapidly and efficiently that we can get these really long lasting results with minimal product. Oh, Jenna. There we go. A little pressure here. Okay. And so we've done the Sculptra for Jenna's scars in the past as well. And really effective. Okay, just a tiny little dab there, pressure, please. So that's it for the Sculptra. And these results, like I mentioned, they're extremely long lasting. We usually do, for someone like Jenna, I would do 1 vial once a year. And so it's very easy, and that would give us great results that are maintained over time. So let me just apply a little pressure here. And then we'll have, Marcus, I'll have you come to the front. We'll do one side versus the other. Okay, that's it. So you can see, you guys see that she's got a beautiful lift already of her cheek and then her eye. Really pretty. Okay, go ahead and do that. Is that okay? All right, so now we will do the Agnes. And for the Agnes, I'm just going to put a few little markings on. So, and this is cleansed with hypochlorous acid. I'll just do a little bit more cleansing. So with this device, we have the option of if someone has fat within the gels, I can melt that fat. And you saw that in some of my before and after photos. Jenna, of course, does not. So we're going to be focusing on mainly tightening her skin. And again, I used cannula with some lidocaine to numb this area. So should still be numb. And this is really great for acne scars too. So we'll do a little test area, Jenna. Feel that? Okay. Here. Okay, and a little heat. How's that, okay? Okay, great. Feel okay? Great. All right. Sorry. I did feel that a little bit. So are there any questions that we're getting? Do any of our viewers have questions?
Does this correct texture issues like hyperpigmentation?
This will correct texture issues. However, hyperpigmentation is usually not included in the texture sort of category. We have seen some hyperpigmentation improve with Agnes, but I would usually start with something else such as IPL, Fraxel, even topicals to help with hyperpigmentation. But we absolutely will see improvement in the skin texture with this.
This one came from Instagram. I believe you touched on it, but they're saying how fast can they see results with Sculptra?
With Sculptra, within a few weeks, you can see results. However, the results keep improving, and we can mix and match Sculptra with filler. So we can do a little filler for instant gratification, and then we can a little filler for instant gratification and a little Sculptra for our long-term effect.
and the results improved for 6 months.
What is the recovery time from an Agnes treatment?
Usually just a few days. Patients, especially when I do someone's neck, patients say they'll feel like a little bit swollen. Work, etc. after a few days. So, all right. So it looks like I'm going to have to touch up her numbing just a little bit, but you can see already she's getting some great results, some tightening, and of course she's got her lift here. So I'm going to touch up her numbing off camera and just in the interest of time, finish her treatment. Thank you all so much for attending, and I hope you give this combination some serious consideration.